We're now joined by Tumelo Mototwane, a South African analyst, to help dissect the issues further. Thank you so much for joining us, Tumelo. What would you say are the takeaways from the president's latest speech in terms of plans to curb COVID-19? And that elephant in the room, good old corruption, has gotten in the way of the war against COVID-19, hasn't it, in South Africa?
Absolutely, and good evening to you from South Africa. I mean, the president did address South Africans just last night, Monday evening, and I mean, to say that there was much to take out of it is really not sufficient. South Africans were expecting a lot more than that. But the president did, of course, say that we are in lockdown level 3. That has been extended to, of course, an amount of time, probably potentially even into February. Now, what that means, perhaps, for the Nigerian viewers, that in South Africa, all the beaches, all, the rivers, all the hotspots areas which cater to entertainment will not be open to the public at this particular time. But also funerals, which have been regarded as super spreader events, have now been minimized to a minimum of 50. And also, the curfew now that we are going through from 9 p.m. until 5 a.m. is what South Africans are seeing right now. But you're absolutely right. Corruption has been at the back of, what has been, a second pandemic in South Africa. And unfortunately, it was government officials as well that have been implicated. The package rightfully said there were allegations made against the Gauteng Health MEC, that's Dr. Andile Masuku, who's now being dismissed and replaced with the new Gauteng Health MEC, Nomathembu Mokheti, as well as the spokesperson to the president, Khusela Digo, who as well has been alleged to have been implicated in PPE corruption. And that's been ongoing right now, whereby she's currently facing an internal disciplinary hearing with regards to her not disclosing her financial interests, because her husband has been found to have allegedly benefited from some of the contracts that have been awarded.
Okay.
Now, the reason why the World Health Organization...
Tumelo, if you don't mind, let me ask you this question then. The Tier 3 lockdown was announced on Monday, and so today a number of businesses are complaining that this lockdown is really going to impact on the economy and the brewing industry, those who are into alcoholic sales and those who are into tourism. They're complaining that this is going to really destroy their business. What do you think the government is doing to respond to their needs?
Industry has been, lamenting to the media, saying that there hasn't been enough transparency, there hasn't been consultation between themselves and government with regards to some of the regulations with which government is tabled. They have said that in as much as they do understand that there needs to be, a balance between profits and livelihoods, they are seeing, of course, a lot of losses in as far as the economy is concerned, and a lot of livelihoods which are at stake. I mean, government has reiterated over and over again, Coyote, that they cannot have, traumas in hospitals at this point due to the abuse of alcohol, because, healthcare workers have been also complaining that while they're taking care of COVID-19 patients, they also, with the unbanning of alcohol, have to take care of those who abuse alcohol and trauma patients that are caused by, accidents or fights, or those who are shot because perhaps they had been drinking from a tavern. So the government has been trying to explain to industry that the reason that in restaurants, but also off-site, which is you purchasing alcohol and consuming it in your home, is due to the fact that the healthcare system just cannot handle the pressure anymore because of those trauma patients that are given that much more pressure to the healthcare.
Tumelo, how soon are we expecting a rollout of vaccines in South Africa?
15th April.
Well, the president last night during his address made mention that within the first half of the year, we should expect at least 10% of, the vaccine that they have procured through AstraZeneca. That should be around, 20 million doses of vaccines. And they've mentioned that they're expecting this to be a priority to be given to healthcare workers, as well as those with comorbidities and the elderly. But a special focus and priority will be given to healthcare workers. Now, there's been a lot of, a debate around timelines because the president could not commit to a date in terms of when exactly South Africa can expect a vaccine. However, he has mentioned during his address that the first half of 2021 is when South Africans can expect the first, dose of vaccines, and then the rest of the 60% of the vaccine rollout strategy should be implemented throughout the rest of 2021, and therefore they're expecting and hoping that 67% of the population will get the jab. I mean, with that being said, South Africa is probably one of the few, if not the only, that hasn't jabbed anyone or received the vaccine as yet, compared to other countries that we have seen globally. So it's been raising concerns around when exactly we will have to see in terms of getting that vaccine. But the president, as mentioned, said that the first half of the year should be the timeline.
Of course, Nigeria is yet to get its vaccines too. Tumelo Mototwane, thank you so much for joining us.